Hey everybody, this is Robin, certified nutrition specialist and strategist, and we're going to talk about vitamin D. So I get a lot of questions, and so I wanted to do this video to cover all the questions that I get at once. So what I'll cover are the benefits of vitamin D, symptoms that you're really low, what your level should be, best ways to get your D, how much vitamin D should you take when supplementing, the difference between D2 and D3, and then we'll talk a little bit about vitamin K. But first, I got to do this disclaimer. So the content of this presentation is solely for educational purposes and increasing awareness. The information, advice, guidelines, dietary modifications, and food supplementation presented here does not constitute the practice of medicine, and it is not intended as a substitute for any medical counseling. So if you are sick or you suspect you have a medical problem, we urge you to seek the advice of your medical doctor or other qualified healthcare providers. Never delay in seeking professional medical advice just because you read or seen something on social media or the internet. All right, and so next bit of housekeeping, hit the thumbs up button and subscribe to the channel and make a comment. I'll be sure to respond to it as well. Vitamin D, y'all, is critical to human health. I mean, I'm passionate about talking about it and educating about it, especially over the last year and a half. It's just, we want to make sure that we have what we need in terms of vitamin D. So 40% of the population is deficient in vitamin D, and then this number nearly doubles for Black folks at around 76%. So the benefits really are vast, right? So vitamin D helps with the immune system, supports the healthy insulin secretion, important for normal cell growth and function, strengthens our teeth, bones, muscles, improves how our hormones function, and can help with depression, anxiety, and mood. So if you're really low, now you can be low and not have these symptoms, but when you're really low, it can show up as mood changes. So maybe you feel overly anxious or down in the dumps, really tired, muscle weakness, bone pain, hair loss, and a weakened immune system. So whenever I have a client that comes to me with any of these symptoms, then I first say, okay, what is your level of vitamin D, and have you had them checked? Have it checked. So what should your levels be? All right, so insufficient, meaning it's below 20 NGs, like that is when you really get to these symptoms. And I've seen it where people have 9s and 11s, yikes. Your ideal level is between 40 and 80. I'll come back to that. And then toxic, which is rare, is above 150. And if you notice, there's this gap, right, between the 21 and 39. We didn't talk about that. Because really you want your levels to show up between 40 and 80. Now, that 40 and 80 range, let me explain that. So 40, for example, let's relate it to grades in school. So when you get a C, you're passing. You're okay. You're good to go. You get a C, you didn't fail, you don't have a D, you have a C, you're okay. So think of that 40 as a C. So if your level is closer to 40, you're not insufficient, you're not deficient, but it could be higher. Like your grade could be higher. So when you're getting it up around the 60s, 70s, and the 80s, then you are doing better. Like you're getting to the B's, the A's, that range. And that's where you want to go. And I'll show you why. First of all, get your level checked. Where are you? Do you know? And even if you don't know, so if you don't know, and you're not in the sun and you're not supplementing, then I recommend that you do, and then get your levels checked so that you know what you need to do and what your plan of action is to get your levels up. So get them checked. And to get your sunlight, to get your vitamin D comes from sunlight or the sun. And the way that our world is today, the way that we're working, we're not always in the sun a lot. And then maybe you put it on sunscreen if you're there, so you're not getting it. You can also get it through food. And so I do recommend, get out in the sun, get your vitamin D, get it in your food. You want to get it. So it comes in egg yolk, salmon, cod liver oil. You can read the list of foods here, and then supplementation. And I personally take 5,000 IUs a day, and I I'm in the sun and I eat my salmon and all the other things, but I just want to make sure that I'm functioning the best, right? So what's the right dose for you? And I would define the right dose of vitamin D as a dosage required to get your blood levels up to 60 to 70 mgs. So that's whatever dose you need to get that level there, that's the right dose for you. And this is the range where your body is maximally supported. Maximally supported how, right? So your risk for cancer is suppressed and it discourages out of control cell growth. Your bone health is maximally supported. It's beneficial for your mental health and your mood, reduction of insulin resistance. So it helps to regulate the insulin receptor gene. Inflammatory and autoimmune condition risk is reduced, and it has a positive effect on your microbiome at this level. Okay. So that's where you want to get to. And then to figure out, where you should start, because that's a question too. Okay, I know the level, where should I start? So I'm going to give you a simple calculation. Take a picture of the screen because I may go fast and you may miss it. And I reference Dr. William Davis, cardiologist, health crusader. Good people, right? So I reference him on this calculation. So just a simple calculation. So 1,000 IUs per 25 pounds of body weight. So example, if you're 145 pounds, divide that by 25 pounds and you'll come up with 5.8, and you times that by 1,000, and that gives you about 5,800 IUs a day, right? And so if you look at that in a week, it's more than 40,000 IUs a week. So that's a good place to start. So again, I take 5,000 IUs a day. That gives you a range of, what your daily consumption. And there's no 5,800 vitamin D supplement at 5,800. So I take 5,000 IUs, but you get the gist. Vitamin D stores. So at the end of the week, you want to get close to the level that you're working on in a week. Hope that makes sense. Again, you can ask questions in the comments and I'll be sure to come back and answer them. So you want to get your vitamin D levels checked if you don't know where you are. And once you know, then you start to increase if you need to. Most of us do. And you want to wait at least 4 months before you go back to recheck. You can wait longer, but you want to at least wait to that 4 months so that your body is getting it absorbed. And as I mentioned to you, it stores. So I take mine daily. Some people take it once a week. Sometimes I forget to take it, rarely, but there's some times. So then I'll just make sure that I double up. I can double up the next day or double up in the week. It stores. So that's how that works. Okay. So some people ask about, can they take too much vitamin D? You would have to take a lot daily over a long period of time to get your blood levels to the toxic level, but so that you know what that number is, that's 150 mg. So if you are just doing an absorbent amount of vitamin D, why are you doing that? But that's the number that would give you pause. Doctors often prescribe 50,000 IUs in a week for people that are like really low, and even more than that, even up to 150, like a lot in a week. So taking 50,000 a week is, it's okay. It's okay. There's no overdosing at that level, right? So 5,000 IUs a day, you're fine. And there's so much information out on the internet. I would just say the Google confusion. You're Googling something, and you see one thing, you see another. And the recommended daily allowance at this moment, which is outdated, is listed at 6,000 to 800 or 600, y'all, 600 to 800 IUs per day. Most people a lot of people are deficient. We're not getting enough. We're not in the sun. This doesn't even cut it. So there's just lots of information out there, y'all. That's just, I don't know what to say. It's just there. So again, I'm going to go back to my admin duties and ask you to hit the subscribe button and like the video and subscribe to the channel. We'll have different experts coming on sharing good information that you can use. My intention is always to share. And if there are other topics that you're interested in, let us know too, because we're here to serve. And as I learn, as I grow, then I'm going to make sure that you all know as well. All right, so let's talk about the difference between vitamin D2 and vitamin D3. There is a difference. And when you're supplementing, you want to use the D3 form, the D3 form. This D3 is more potent in raising your levels and doing so for a longer period of time. It's the human form, so it's biologically active and it's produced in humans, right? So that's the natural form of vitamin D. And then you might say, well, my doctor prescribed vitamin D2. Why? So doctors cannot prescribe something that is natural, which is D3, and it's widely available. You can go and get D3 from anywhere, and it's from the sun. So can't make a prescription for that. So D2 is a pharmaceutical. So it's synthetically made, and that's only what your doctor can prescribe. And then also the doctors are sometimes prescribing megadose. So they have that 50,000 megadosed pill for people that they're trying to, flood their body with it. You can still, well, we'll leave it at that. That is why the doctors prescribe that, because they cannot do the other one. And if you need more, so for example, I'm taking 5,000 a day. And if I needed more, if I needed to take 10,000 a day because I wanted to equal up to, more than 40,000 I use in a week, I could take more of those, because I take 5,000 I use, so I could take more to equal up to what I'm wanting to do. So there are megadose pills that have 50,000 IUs in one megadose. And so for some that's needed, for some that is needed. So that's for your doctor to tell you. All right, K2. Some of you have heard about K2, some people have not, but I want you to be in the know. So K2 provides beneficial support for the bone health, and it helps with the absorption and transporting calcium to our bones. And also K2 helps with the absorption of D3, as well as cardiovascular protection. And K2 is not widely available in food, but it can be found in kefir and sauerkraut. So I would say this to you: do your research whether or not K2 is necessary for you. Consider if you are postmenopausal, over 50, have a history of osteoporosis or cardiovascular disease or gut issues. See if you need the K2 with your D3. So ask your healthcare provider, and some of you already know, so your healthcare providers already let you know that you want to add in your K2. So I'm going to leave that to you to do that research to figure that out. But I want you to be in the know about it. And as we wrap up, again, hit the thumbs up button on the video, subscribe to the channel, make any comments that you'd like, and I'll be sure to answer any questions that you have that way. And lastly, people say, well, where do you get vitamin D3? So of course, Necessary Nutrition has it available for you. We have D3, 5,000 IUs, as well as D3K2. And you can visit our site to get that, or somewhere below in this video, there's the link to it as well. We welcome the opportunity to help you get your vitamin D levels up to par, because we know that it's important. And we want to support you in doing that and continue to be your nutrition partner and resource when it comes to these types of things. All right. So with that being said, I'm going to close up. Thank you so much for hanging out with me today. Eat well, think well, and be well. This is Robin, Certified Nutrition Specialist and Strategist. Peace and blessings, y'all. Take care. I'm going to shut off the recording. I got to figure out how to do it. All right. All done.